Today, I need to have a very honest conversation with you. If you are over 60 years old and you still pleasure yourself, I need to ask you something that you have probably only ever asked yourself in silence. Have you ever wondered whether this is still good for your body at 60, 70, or even 80 years old? Or have you quietly worried to yourself, am I damaging my hormones? Could I be ruining my prostate? Is this somehow weakening my health in some way? If you have ever had those thoughts, let me tell you something right now. You are not alone. This is one of the most common concerns that older men have carried silently for decades without ever daring to ask their doctor. They have been surrounded by baseless rumors, social shame, and a complete absence of clear medical information. You have been told that this drains your energy, weakens your body, and is even dangerous for your health. But what does modern medical science actually say? When we strip away all the shame and the noise, the real answer is surprisingly reassuring and full of things worth knowing. A study from Harvard University followed nearly 32,000 men over several consecutive months and found that men who ejaculated more frequently, at least 21 times per month, had a 31% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. 31%, my friend, that is a number very much worth talking about today, but like any medical tool, it depends entirely on how you use it. Done the wrong way, it carries real risks that you need to know about. Today, I am going to walk you through the full medical picture. I will talk about the surprising benefits that science has uncovered and the real risks that you absolutely must know to keep this practice healthy. Part 1. Why we need to talk about this. Before we get into the main content, I want you to understand something important. I am a doctor and I have worked with many older patients over the years. One of the things that saddens me most in this profession is seeing healthy, intelligent men who have lived good lives but who carry quiet worries about their sexual health without daring to say a word to anyone. They silently fear, silently blame themselves, when in reality what science says is completely different from what they imagined. Our generation grew up in an environment where this topic was considered taboo. Nobody taught us about this in school, nobody in our families ever mentioned it. And as we step into our 60s, 70s, even 80s, the question becomes even more complicated because our bodies change, our health changes, and we do not know where we stand anymore. So today, I want to be your companion, not as a doctor sitting stiffly behind a desk, but as an older friend sitting at the same table with you and telling you everything that needs to be said. And what I want to say right now is this. It is completely normal. The human body does not have an expiration date in this area. Science has clearly shown that the natural sexual drive of human beings continues to exist at 60, 70, even 80 years old, and that is perfectly healthy. Part 2. What happens to your body after 60? Now let me tell you about what is actually happening inside your body when you cross that 60-year threshold, because this explains everything. When men enter this age range, the body begins producing less testosterone than it did back at 30 or 40. This is a completely natural and normal process, not a disease, not a sign of anything wrong. But this change brings along a whole series of other changes that you may have already noticed. First, the time it takes to become and stay aroused may be longer than before. That is completely normal with age. Second, your body needs more recovery time between sessions. Third, blood flow to the smaller vessels in the genital area tends to decrease if we do not maintain regular activity. And this is the most important point I want you to remember today. The body follows one very simple principle that medicine describes as use it or lose it. This applies to your muscles, to your brain, and especially to the circulation of blood to the sensitive tissues of your body. When you maintain healthy sexual activity, whether with a partner or through self-pleasure, you are helping to keep blood flowing to those areas, keeping the tissues healthy and maintaining normal function. When you stop completely, over time, those tissues can begin to shrink, stiffen, and become harder to recover. That is why urologists today actually encourage regular sexual activity in older adults, not because we want you to push yourself, but because it is a way of protecting your long-term health. Part 3, the real medical benefits. Now let us talk about the specific benefits that science has documented. I am not going to speak in vague terms. I am going to go straight into each one because you deserve to know the clear truth, not fuzzy answers. Benefit number 1, prostate protection. This is the most important benefit and the reason why thousands of urologists across America are having this exact conversation with their patients right now. As I mentioned in the opening, the Harvard University study tracking nearly 32,000 men over many months found a clear connection between ejaculation frequency and prostate cancer risk. Why is that? Your prostate constantly produces fluid. When that fluid is not regularly flushed out, it builds up inside the gland. And over time, that buildup can create an environment where abnormal cells are more likely to develop. Regular ejaculation, whether through intercourse or self-pleasure, naturally cleans out the prostate. Think of it like changing the water in your fish tank. If you do not change the water regularly, the water gets dirty and the fish gets sick. Benefit number 2, cardiovascular health. This is something that surprises a lot of people. Sexual activity, including self-pleasure, is actually a gentle form of cardiovascular exercise. Your heart rate goes up, blood circulates more strongly throughout the body, and your blood vessels get a workout. For older adults who cannot go to the gym or walk much because of joint pain or other health issues, this is genuinely a form of movement their body can do without putting pressure on the joints. It is certainly not a full replacement for exercise, but it contributes meaningfully to your overall circulatory health. Benefit number 3, sleep and relaxation. Many older patients come to me complaining about insomnia. They have tried everything from herbal teas to sleeping pills. But few people realize that when you reach orgasm, your body releases a wave of natural chemicals, including oxytocin and prolactin, and both of these calm the nervous system and create a very strong natural feeling of drowsiness. This is the medical explanation for why so many people sleep exceptionally well after sexual activity. Your body is essentially giving itself a free, natural sleep injection with zero side effects. Benefit number 4, stress and anxiety control. When your body goes through orgasm, it also releases endorphins and dopamine, two natural brain chemicals that act like natural painkillers and natural antidepressants. A study from Duke University tracking more than 3,500 older adults over multiple years found that people who maintained regular sexual activity at 60 and 70 years old had significantly lower rates of depression and anxiety compared to those who no longer had sexual activity. This is not a coincidence. Your brain needs these chemical signals to keep your mood stable, and sexual activity is one of the most effective ways to activate them naturally. Benefit number 5, maintaining function. This is a very practical medical truth that I want you to hear clearly. For older men, the ability to get an erection is like a muscle. If you do not use it, you lose it. Without regular sexual activity, the erectile tissue in the penis receives less blood over time. Oxygen in the blood is what keeps those tissues healthy and flexible. When oxygen is lacking for an extended period, the tissue can begin to fibrose, meaning it stiffens and loses its elasticity. This is the medical reason why some men who have gone a long time without sexual activity find it harder to achieve an erection. Maintaining regular sexual activity, even through self-pleasure, helps keep those tissues receiving adequate blood flow and preserves normal function longer. Benefit number 6, pain relief. This is something most people do not know. The endorphins your body releases during sexual activity do not just improve your mood, they also act as natural painkillers. Many of my patients report that after sexual activity, their joint pain, back pain, or headaches decrease significantly for several hours afterward. The mechanism is exactly the same reason why running or exercising helps reduce pain. Your body produces the most powerful painkiller in the world all on its own, and it is completely free. Benefit number 7, mental health and self-worth. This is something that mental health doctors emphasize a great deal. When older adults can still maintain a positive relationship with their own body, still feel that they have vitality, still feel attractive, still feel like a complete human being, that directly affects how they see themselves and how they see life. Many older adults go through periods where they feel their body is betraying them, becoming a burden, losing what once made them who they are. Maintaining a healthy relationship with sexuality is a powerful way of telling yourself that you are still here, you are still living fully, and that has real medical value. Part 4, the real risks you need to know. Now I am going to talk about the part that many other videos do not dare to say directly. The real risks. Because I told you from the start, I want to tell you the truth and the whole truth. Not to scare you, but so that you can do this in a smart and safe way. Risk number one, excessive cardiovascular strain. This is the most important risk, and I want you to listen very carefully. If you have a history of heart disease, uncontrolled high blood pressure, or you have recently experienced a heart attack or heart surgery, you need to speak with your doctor before continuing any sexual activity. During orgasm, heart rate and blood pressure spike suddenly for several seconds to several minutes. For someone with a healthy heart, this is not a problem. But for someone with a weakened heart or damaged blood vessels, that sudden spike can be dangerous. This is not to say you cannot do this. It is to say that you need your doctor's specific guidance and clearance first. Risk number two, injury from improper technique. This is a risk that few people talk about, but it is actually very common. At 60 or 70 years old, your skin is thinner, your tissues are more sensitive, and your body's ability to heal itself is much slower than when you were young. If you use too much force, too much friction, or go too long without lubrication, you can cause small injuries to the skin and tissue that may develop into sores or infections. This is especially dangerous for people on blood thinners, a very common medication among older adults, because even small wounds can bleed more and take longer to heal. Risk number three, medication interactions. Many older adults are taking medications for multiple conditions: blood pressure medications, diabetes medications, heart medications, antidepressants. Some of these, particularly blood pressure medications and antidepressants, can directly affect sexual function and how the body responds during sexual activity. What matters is that you understand what your medications do to your body, and if you ever notice any unusual changes such as chest pain, dizziness, or an abnormal feeling during or after sexual activity, stop immediately and contact your doctor. Risk number four, addiction and unhealthy frequency. This is a psychological issue that few doctors discuss with older patients, but it is very real. Especially for people who feel lonely, are going through the loss of a loved one, or are struggling with depression, sexual activity can become their only coping mechanism. When it becomes the only thing you do to feel better, that is when it is no longer healthy. It is not about the number of times. It is about why you are doing it. If you are using this to escape emotional pain, that is a sign you need to speak with a doctor or a counselor. Risk number five, ignoring warning signals. This is perhaps the most dangerous risk I want to emphasize. Sometimes during sexual activity, the body sends out warning signals that we ignore because we are focused on other things. If you feel chest pain, shortness of breath, sudden dizziness, pain in your left arm, or any other unusual sensation during sexual activity, stop immediately. These symptoms are not normal and could be signs of a serious cardiovascular problem that needs immediate attention. Risk number six, impact on an already diseased prostate. I told you that regular sexual activity protects the prostate. But here is the other side of that coin. If you currently have acute prostatitis, or if you are undergoing treatment for prostate cancer, excessive sexual activity can worsen the inflammation and create significant discomfort. In these cases, you need to follow the specific guidance from your urologist regarding safe frequency. Risk number seven, social isolation. This is more of a social risk than a purely medical one, but it is closely tied to your overall health. When self-pleasure becomes the only substitute for human connection, intimacy, and affection, it can quietly lead you to seek real connection less and less. Especially for those who are widowed or living alone, it remains important to continue maintaining social relationships, family ties, and community connections, because human health needs both physical and emotional connection. Part 5. So, how much is enough? This is the question everyone wants to ask, but few dare to. And the honest answer is that there is no single exact number that applies to everyone. Your body is different, your health history is different, and what is healthy for one person may not be healthy for another. But there are a few general principles that medicine agrees on. First, listen to your body. If after sexual activity you feel prolonged fatigue, soreness, or general unwellness for many hours afterward, that is a sign you need to reduce your frequency. The aging body needs more recovery time, and that is completely normal. Second, quality matters more than quantity. One slow, comfortable session without rushing and with adequate recovery time is better than multiple forced ones. Third, if you are on multiple medications or have underlying health conditions, ask your doctor about the specific frequency that is appropriate for your personal health situation. This is not an embarrassing conversation to have. It is part of comprehensive health management, and a good doctor will always be willing to discuss it with you. Part 6. Practical things you can do right now. We have talked enough about theory. Let me give you the most practical takeaways. The first and most important thing is to use lubrication. I am not saying this to make you uncomfortable. I am saying this as a doctor giving you serious medical advice. At 60 and beyond, skin is thinner, tissue is more sensitive, and natural moisture decreases. Using a water-based lubricant not only makes the experience more comfortable, but actually protects the tissue from unnecessary damage. You can find these products at any pharmacy, and there is absolutely nothing embarrassing about buying them. The second thing is to slow down. One of the most common mistakes older men make is trying to recreate the way they did this back at 30 years old. Your body at 65 is different, and that is not a bad thing at all. It is simply different. Give yourself time, do not put pressure on yourself, and do not measure success or failure by the standards of when you were young. The third thing is to pay attention to your body's signals. Some symptoms that mean you absolutely must stop and see a doctor include prolonged pain or burning after sexual activity, changes in the color or amount of urine, the presence of blood, or lasting pain in the lower abdomen or lower back. These symptoms are not normal and need to be evaluated by a doctor. The fourth thing is to maintain your overall health. Healthy sexual activity cannot be separated from overall health. If you are sleeping well, eating right, moving your body moderately, and managing your stress, your body will function better in every way, including sexually. The reverse is also true. If you are chronically tired, eating poorly, and not moving, your sexual health will be one of the first things to be affected. Part 7. Breaking the biggest myths. Before we close, I want to spend a moment breaking down the 3 biggest myths I hear from my older patients, because these myths have caused far too much unnecessary worry for far too many people. Myth number 1. Self-pleasure drains your energy and weakens the body. This is the oldest myth of all, and there is no scientific evidence supporting it whatsoever. The energy your body uses during this activity is very small, roughly equivalent to walking for about 2 to 3 minutes. Your body fully recovers from that within 1 to 2 hours. This myth comes from ancient ideas about vital force that modern medicine has long since debunked. Myth number 2. Older adults should no longer have sexual desire. This is a social misconception, not a medical truth. Many studies have shown that sexual desire can continue to exist in healthy individuals well into their 80s and 90s. This is a sign of a normally functioning body and brain, not something abnormal or shameful. Myth number 3. If you have problems with erections, just give up. This is the most medically dangerous myth because it leads to the exact opposite of what you actually want. Erectile dysfunction in older men is usually caused by insufficient blood flow. And as I said, the way to address that blood flow problem is to maintain activity. If you are having trouble with erections, the right answer is to talk to your doctor to find the cause and treat it, not to give up entirely. Part 8. When you should see a doctor. I want to close the main content with a specific list of situations where you need to speak with your doctor about this topic. A study from Mayo Clinic found that more than 60% of men over 65 have at least one sexual health concern, but only about 25% of them ever actually bring it up with their doctor. That is a very large gap, and it leads to many treatable problems being left unaddressed. You should see a doctor if you notice any sudden change in sexual desire, especially a sudden drop, because that can be a sign of a hormone issue or another medical condition. You should see a doctor if you experience prolonged pain or discomfort after sexual activity. You should see a doctor if you notice any abnormal urinary symptoms, such as difficulty urinating, waking up more often than usual at night to urinate, or blood in the urine. And you should see a doctor if you feel anxious or distressed about this topic, because both your mental and physical health matter equally, and a good doctor will listen to you without judgment. After everything we have talked about today, I want to leave you with one final message. Your body at 60, 70, or 80 still deserves to be cared for, respected, and understood. The fact that you took the time to learn about your own health Even on a topic that society never taught us to discuss openly, that is the action of a smart person who takes responsibility for themselves. There is nothing to be ashamed of here. There is only medical truth and smart choices. Listen to your body, keep up healthy habits, avoid the risks I laid out, and do not be afraid to speak honestly with your doctor because that is the one person who can give you the most personalized advice for your specific health situation. If this video helped you today, I have one small request. Please share it with your partner, your brothers, or the older loved ones in your life so they too can understand these important things and avoid carrying around worries they do not need to have. Hit that like button so this video can be recommended to more older adults who need these answers. And subscribe so we can meet again at the next piece of health advice because there is still so much more I want to share with you.